Re- Rheumatic fever is a very common disease still in this part of the world because the proper management and uh, prevention is not carried out. It is caused by beta hemolytic streptococci, which affects the throat, and it can cause two types of diseases. It can cause a rheumatic fever. It can cause also acute glomerulonephritis. Rheumatic fever is defined through the Jones criteria, minor and major. There can be carditis, polyarthritis, chorea. Then it can also cause to increase, uh, can cause proteinuria in the urine, and it can also cause erythema marginatum, subcutaneous nodules in the shin of the legs, and also it can later on it causes valvular heart disease, especially mitral stenosis. Mitral stenosis is a progressive lesion in which the mitral valve becomes stiff and the diameter becomes narrow, and then the left atrium cannot much pour blood into the left ventricle, and there's a backflow then, and then it leads to secondary pulmonary hypertension. uh, it can also cause hemoptysis, shortness of breath, fatigue, and these are the manifestations of the heart being affected. Mitral stenosis clinically is, if on examination, there is a mid-diastolic murmur with pre-systolic accentuation, and there is an opening snap. It also causes, in the long term, irregular heartbeat, atrial fibrillation, which then has to be managed with anticoagulants, warfarin, sodium. And the warfarin, sodium has its own problems. The INR has to be managed, and it has to be kept ideally between 2.5 to 3.5. And if it goes above 4, it's a matter of concern. And if it hovers around 2 or less than 2.5, then it's a matter of concern, because then we have to stop the prothrombotic state and prevent a thrombus forming and an embolism occurring, which can lead to stroke and loss of limbs and loss of the renal circulation too, leading to renal failure. Warfarin in the long term has its complications. It can cause osteoporosis, and another thing with mitral stenosis is there is a high rate of complications in pregnancy, and there is a high morbidity and mortality. So this has to be very closely followed up with a cardiologist, a good OBGYN team, and a critical care management. Now still there is a contemplation of use of novel oral anticoagulants, but still warfarin remains the cornerstone of therapy. Uh, Mitral stenosis is one of the valvular disease. Another is other in order the tricuspid valve, the aortic valve, and in some cases pulmonary valve can be affected too. And this has to be followed up clinically, an ECG, echocardiogram, uh, a visit to an internist and a cardiologist, and there are actually warfarin clinics in other parts of the world, uh, because there are so many patients on warfarin other than mitral stenosis, other than rheumatic fever, because of cardiomyopathy and atrial fibrillation and other irregularities of the heart. These things are extremely important, and we need to make an algorithm and have a rheumatology clinic of rheumatic heart diseases in Pakistan, and then as a preventive further measure, those people who already have rheumatic heart disease, they need prophylaxis with antibiotics, and one can also use benzathine penicillin injections 2.4 million units every month, so to prevent a further uh, attack of rheumatic fever because of beta hemolytic streptococcal throat infection. Other than that, we need to develop preventive mechanisms in which, like there is a beta strep screen on throat infections, and those people who are deemed who can develop this disease are given penicillin, and the thing is stopped right in its track. My name is Dr. Munir Hussain Faswala. I do practice at Samrose Hospital, Karachi, at Sunny Medical Center at Suparko Road, Karachi, Karachi Medical Complex, Gulshan Iqbal, Block 16, Karachi. My telephone number is 02134380964. My mobile number is 0092 300 2502 669.